COVID numbers have risen in Mpumalanga since the beginning of the festive season. The numbers are actually rising every single day here in Mbombela. The MEC of Health here in the province, Mr. Sekane Manzini, has been going around the province actually to sensitize the people to make sure that they comply with the regulation of the COVID-19. She is today here in Hazyview to actually speak to mall owners and also to speak to tenants in these malls and also taxi ranks and also people who are coming onto the mall and also using the public transport to get home, to speak to them about compliance, especially when it comes to COVID-19. Let's speak now to MEC of Health, Mr. Sekane Manzini. May just talk to us about the numbers. We've seen that the numbers have gone up since the festive season started, and also the numbers, they keep going up as we speak. In terms of numbers, how far are we in terms of the province and where are the hotspots?
Thank you very much and greetings to the viewers at home. I can indicate that indeed you're correct. As a province, during the week of the 15th and the 24th, we have seen the numbers increasing in the province. Now we are sitting at more than 4,040 active cases, of which is a serious concern for us as a province, because before the festive we were recording less than 1,000 active cases, and we're doing very well because our people were recovering at a higher rate. So, but now since the festive season, you'll understand that everyone will be coming from Gauteng, coming from your different provinces, coming home. Hence, we have seen a quite high number of cases in the province, and also those that are going to the nearest countries, your Mozambique and your Swaziland, you'll know that they pass via the province. So as a province, we have developed a resurgent plan where we are targeting the hotspots. Hence, we are here today at Mbombela, where they are having a number of more than 1,023 active cases as a municipality, of which is a concern. We are also monitoring your eMalahlani, your Steve Tshwete, and also Govan Mbeki. Hence, tomorrow we'll be going to those municipalities. But we want to request our people to continue to assist us as government in terms of observing the health protocol. Especially, we are here today, you have observed yourself that some of the people are not even putting their mask, of which is a serious concern for us. But of course, we're having the center manager who's trying also to make sure that people comply. But also we have agreed that a lot can still be done in terms of also we are going to speak to the taxi association, because also we are seeing in the taxi rank some people are not wearing their mask, of which is something that we need to correct, because we believe that if we want to cap the spread of the COVID-19 in the province, we need to work together. The behavioral change of our people is going to assist us as a province, but we hope that as we continue rolling out this program and being assisted by the different municipalities, we'll be able to deal with this challenge that we're facing.
May you just talk to us about, obviously we've seen that the numbers are 4,000 now, and they are likely to go up, especially when other people are also returning to the province, especially those who have been on holiday returning to the province, and also because we know that Mbombela on its own and eMalahlani, they are transit to go to other countries. They're also transiting to go to holiday destinations such as Kruger National Park, Mozambique, and all those kind of things. What are you guys going to do and to make sure that we keep the numbers, and also what are you guys going to do in terms of hospitalization? How far are we with in terms of hospitalization? How many people are in hospital, especially with now the numbers being 4,040 in the province?
Top of our list as monitoring in the province is the issue of hospitalization. I'm closely monitoring that aspect, and we're working also with the private hospitals where they're all reporting on a daily basis. So far, we can indicate that we're having over 300 and something people that are hospitalized, of which is something that is a concern, because on a daily basis we are seeing an increase in the number of people being hospitalized. So that on its own, it tells us that the people that are positive now with COVID-19, they are no longer having mild symptoms. They are now severe, hence they are hospitalized. So we want to continue to do that. Our quarantine facilities, our isolation facilities in the province are in place, and hence as one of our programs, I'll be monitoring one of our quarantine facilities, because we need to work towards being ready in terms of those that are going to need to be hospitalized. But we are working very well with the private sector so far, so that we are also, when we talk about isolation and the hospitalization in the province, it includes both private and public. So we want to continue to do that as a province, because we are saying we are working with the SABC, we are there in all the roadblocks, screening, so that anyone who's found to be having symptoms of COVID-19, they are able to be quarantined and isolated. So we are working with all the different key stakeholders. The municipalities also are playing a key role in assisting us as far as monitoring, and also in terms of awareness campaign in the different municipalities.
May we just seen also at the Lebombo border post and also at Eswatini, people actually testing positive, and also especially those who will be traveling back. What is the way to help them, to assist them to actually get the COVID-19 results quicker so that they can travel, especially those we've seen that people have been turned back at the border post because they don't produce a correct or fraudulent COVID-19 test. What has been going on there, especially today, especially in Lebombo and also at Osho border post?
We have been saying to our people, when you know that you are planning to travel, you must get a 72 hours COVID-19 test. Hence, we are surprised that there are people who will go to the border gate without a COVID-19 test. However, there is NHLS in those borders where they are able to test you if you don't have the results. However, also in terms of the antigen that you are able to test, the results comes after 20 minutes. But it's only accepted in your Mozambique, Swaziland, they don't accept that. But we want to ask our people to take the test where they're coming from, because we don't want to have so many people coming to the border when they're supposed to just cross, but they now start to need to get a COVID-19 test. But we encourage them to do that at home. But so far as monitoring and at that level, you have seen that we have been there and we're working very close with your Home Affairs, SABC, and the National Department of Health. And we can say that even though there were challenges, but we managed the festive very well. And now we are getting ready, of course, for people coming back into the country. Those are going to the other countries. So we urge our people to work with us and make sure that the necessary document they do have when they are supposed to travel.
Thank you so much, Mayor. That was MEC of Health here in Mpumalanga, Mr. Sekane Manzini, actually speaking to us about the number of issues that they have seen here in Mbombela. They are saying that compliance is still a problem here in Mbombela. They've been speaking to a lot of people, especially tenants and also people who are coming here, shoppers who are coming into the shops, to actually wear their masks, because mask wearing is still a problem here in Mbombela region. And also the MEC is saying that they will be working with those at the border post to make sure that the people there are being assisted as quick as possible so that they can be processed there at the border, especially those who are not who go to the border without a proper documentation, especially those COVID-19 results tests that they have been doing. But so far, the MEC will be continuing with her operation today and throughout this week to make sure that she goes to all those regions, especially hotspot regions such as Mbombela, eMalahlani, and also Gersibandewe. The numbers there are actually on the rise there. Back to you.